Hello, my name is Jordan Paskey, and today I am going to be taking a deep dive into Graves' disease, which we have not covered at all in our course this year. So I wanted to take a deep dive into it. It's been pretty interesting to me. I didn't realize how impactful our thyroid gland is to our bodies. So this was very, very intriguing for me. So let's get started. So, what is Graves' disease? It's an autoimmune disease that directly attacks the thyroid gland and causes an overproduction of thyroid hormones in the body. The thyroid gland produces less thyroid stimulating hormone and increases the production of thyroid hormones T3 and T4 specifically. Thyroid stimulating hormone is responsible for stimulating the thyroid gland to either increase or decrease the production of T3 and T4. And if there's less TSH in the body, it's just going to continue excessively producing more T3 and T4, even if the body is at full capacity, because the TSH is not decreasing it because it's completely obstructed. The etiology. So, like I said, this is due to the TSH being obstructed by autoantibodies that manifest from Graves' disease. And these autoantibodies have the ability to replicate the task of TSH, which they are just continually stimulating the thyroid hormones receptor to release more T3 and T4, even if the body has reached full capacity. This condition goes hand in hand with the development of hyperthyroidism because of this overproduction of hormones. So, symptoms of Graves' disease. One of the most common symptoms and problems that arise from Graves' disease is the development of Graves' orbitopathy, which affects the eyelids. It makes them protrude and bulge outwards and causing severe pain, discomfort, and also vision issues. Other symptoms include the evolution of a goiter, an abnormal fast heart rate, heat intolerance, fatigue, diarrhea, and weight loss. Risk factors for Graves' disease. This is from family history. If you already have an autoimmune disorder, those go hand in hand together. Also, age, gender, stress levels, environmental factors, and having an unhealthy lifestyle can increase your chance of getting Graves' disease or any problems with your thyroid. So, like I said, Graves' disease plays a role in a patient's development of hyperthyroidism, which just can cause even more symptoms to arise. And this is from that overproduction of these hormones that are not needed. So the risk population for Graves' disease, it's very, very common in women, mainly in women, but men do get it too. Postpartum women are at risk for developing Graves' disease because of the extreme emotions and high stress levels they are facing, which that's also another contributor to Graves' disease. Individuals who are genetically predisposed for developing Graves' disease or any other autoimmune disorders, they are highly likely to develop any autoimmune disorder if it runs in the family, and also lifestyle choices such as smoking or a diet lacking iodine because our thyroid gland needs high iodine to function properly. So the epidemiology I have found, so again, as I've mentioned, Graves' disease is a precursor to hyperthyroidism. It is most likely to occur between the ages of 30 and 60. It is 5 to 10 times more common in females than in males. And 79% of the risk for GD is connected to inheritance from your family, while 21% of the risk is linked to environmental factors. 70% of genes that are related to autoimmune thyroid disorders are associated in T cell function, which these T cells help our thyroid gland function properly. So, the social and mental health impacts, this can severely affect an individual's quality of life due to the physical manifestations that arise when an individual does have Graves' disease, which makes neurological disorders and mental health issues very prominent in GED patients. There are studies that have been conducted that verify that patients are more likely to develop mental health disorders if their GD is more severe and their symptoms are more severe. The bulging of the eyes resulting from Graves' orbitopathy causes severe discomfort and can make it very difficult to complete tasks, which can make a person feel unworthy, and this can make a drastic decline in their overall well-being compared to patients with other disorders. And GO patients' symptoms make them feel insecure in social settings due to the goiter or their eyes, specifically GO, with their eyes bulging and protruding and just looking very wide and red. They can feel very insecure and want to isolate from the world due to this. So, how can we diagnose Graves' disease? First of all, if you see physical manifestations such as a goiter or your eyes are bulging, you should definitely get checked. Blood tests are used to identify the amount of thyroid stimulating hormones are in the body and overall thyroid hormone. If there is not a lot of TSH in the body, this could be a big indicator that you have Graves' disease because your thyroid is being stimulated by these autoimmune antibodies, excuse me, that are being produced by Graves' disease. So you would get another test called TSH receptor antibody lab test, which shows us and measures how many autoantibodies are in the body. There is also a radioactive iodine uptake test, which gives medical professionals an idea of how much radioactive iodine your thyroid hormone can process and how fast it can process it. And this can tell us a lot about how your thyroid is functioning overall. So, the prognosis for Graves' disease, if it is treated early enough and diagnosed, the prognosis is very positive. It can't be cured, but there are several measures that can be taken to help manage it and make a patient's overall quality of life a lot better. It is very crucial, in my opinion, it's very crucial for patients that have developed Graves' disease and Graves' orbitopathy to be regularly evaluated for mental health issues because of their symptoms and how severe they are and how they show on the body. I think it's very important to be checked for mental health disorders. And with adequate treatment courses, which we're going to talk about in the next slide, and proper mental health check-ins, a patient can live a happy and fulfilled life with Graves' disease. It is possible. So, treatment for Graves' disease, there are multiple avenues that one can take. So there are thionamine compounds, which blocks the functioning of an enzyme called thyroid peroxidase that releases thyroglobin to produce more thyroid hormones. So if there's already an excessive amount of hormones, this could be a good option to block that enzyme from stimulating for more. Radioactive iodine, which we've discussed, it destroys those autoantibodies that function to constantly stimulate for the release of hormones. Antithyroid medicines function to stop the thyroid gland from being able to use iodine to create hormones because we do need iodine in our diets. It helps for normal functioning of the thyroid, but if there are these autoantibodies in our thyroid and in our body, we don't need the hormones to be functioning off of the iodine that we are ingesting. So these medicines can stop that. Beta blockers ensure that the function of the hormones created do not have an influence on the body because they have already taken a big toll if there are way too many hormones. So they'll still be able to be made because we still need them, but they're not going to have a huge toll on us anymore. Total thyroidectomy, which is the removal of the thyroid gland, especially if that goiter that develops gets too severe and needs to go. And also, it's been shown in studies that if you remove that goiter, this could help manage other symptoms that are linked to Graves' disease and improve a patient's quality of life. And then prescriptions from doctors to help manage thyroid eye issues that arise, especially the redness, vision issues. You could even develop thyroid eye diseases. So it's very important to go to a medical professional to see what treatment you can get for Graves' disease or thyroid issues in general. And here are my references I used, and I found this very interesting. I really enjoyed looking into Graves' disease and writing these essays to learn more about it. I feel very more educated about this, and I think the more education we have about thyroid issues and how we can manage them, how we can even prevent them from even occurring, I think that will help decrease the chance because this is a very common disease. And I think that will help decrease how many people are getting it, especially women. So, thank you for listening today, and I'm very glad I had the opportunity to do this. Have a good rest of your day.